Good afternoon. Thank you for tuning in to the Government of Newfoundland and Labrador's COVID-19 news conference. I'm Leslie Clark with the Department of Health and Community Services, and I'm the moderator for today's question and answer session. Joining us today is the Honourable John Haggie, Minister of Health and Community Services, who is joining us via Skype from Gander, and Dr. Roseanne Sevier, Acting Chief Medical Officer of Health. Please stand by. Our news conference will begin shortly.
Thank you very much for joining us this afternoon for our update. Before I start, I'd like to thank the ASL interpreters for making themselves available at short notice. If they haven't quite arrived yet, they are en route. As usual, I will turn this over to Chief Medical Officer of Health for an update on the numbers. Roseanne?
Thanks so much, Minister. Good afternoon, and thank you for joining us today. Since the last media advisory, we have had 45 new confirmed cases of COVID-19 in our province. In the Eastern Health Region, we have 3 cases. 2 are under investigation, while 1 is related to travel. In the Western Health Region, we have 3 new cases, all under investigation. In the Central Health Region, we now have 39 new cases, all under investigation. 13 of these were previously reported as presumptive positive. There are also 18 new presumptive positive cases in Central Health. There have been 13 new recoveries, leaving 109 active cases in our province. The total number of COVID-19 cases for our province is now 1,654. 2 people are hospitalized as a result of COVID-19. A total of 294,264 tests have been completed to date. We continue to see some new cases in the central region of the province, and this is expected given that we have community spread in this area. There are now a total of 70 confirmed cases connected to the outbreak. We are starting to see the outbreak shift, with fewer new cases being detected in the Bay Verte region. We are, however, seeing an increase in the Twillingate region. We are therefore expanding the region under Alert 3 to include Twillingate, effective immediate midnight tonight. Additionally, we now have 10 confirmed cases associated with the New World Island Academy, and as a result, the school will be closed for in-person learning. We recommend that people avoid non-essential travel in and out of areas under Alert Level 3. Essential travel includes travel for work, studies, essential shopping, or medical reasons. Central Health continues to work diligently on identifying and contacting anyone that may have been exposed to the virus. There were a number of public exposure notifications issued yesterday for the Central and Western region. I encourage anybody in these areas to visit our website to see if these advisories apply to you. If you are in Bay Verte, Twillingate, or Gander, testing is available for anyone that is identified as a close contact or has symptoms. You do not need an appointment. If you are outside this region and need a test, please use the online booking tool on our website. If you have even 1 mild symptom, such as a runny nose or a sore throat, please get tested. Do not assume it is a cold. A case identified is a case contained. This allows public health to do their work to both identify contacts and to determine the extent of transmission in an area. The single most important thing you can do right now is to be vaccinated. Delta is overwhelming our country right now and exceeding hospital capacity in several jurisdictions. You may have heard the heartbreaking pleas on social media from those hospitalized with COVID-19, wishing they had made the choice to be vaccinated when they had the opportunity. We need to get all our regions and all our age groups to a higher level of vaccination. That will give our province the level of protection that is needed to be an effective barrier against the Delta variant. Delta is more transmissible and is associated with more severe illness, even more so than the Alpha variant that we experienced in February of this year. That's why it requires better immunity in our population. Since the vaccination campaign began, we have implored everyone that is eligible for the vaccine to get the shot. I believe that most people have put off getting the vaccine because they don't feel they were at risk of the virus here in our province or in their smaller community. The 4th wave, though, unfortunately, has reached our shores. We have stared down the face of COVID before, and we will do it again. We have 18 months of this pandemic under our belt. It has been a long haul for everyone, but those 18 months have armed us with the knowledge, tools, and the ability to keep ourselves and our loved ones safe. Wear your mask in indoor public spaces. Remember, the mask mandate is now back in effect. And wash your hands well and wash them often. And take care of yourselves and your family. Delta is here, and we need to show it the door. Make the choice, take the time, get the shot. Thank you, and stay safe.
Thank you very much, Dr. Stevia, for your update. 109 cases is a threshold we had hoped we wouldn't see again. But quite frankly, it speaks to the importance of vaccination at the community level. We've seen this take hold in communities where vaccination rates have been far lower than the provincial average, both in Bay Verte Peninsula and latterly in the Summerford area around Twillingate. This is preventable. There is a vaccine, and I would urge you, as Dr. Recevia has said, to get the shot. It is crucial that we all have that same level of protection. The best protection for each of us is the protection for all of us. There are vaccination clinics available in those areas and have been for several months. It is sad that people have driven past those clinics on the way to recreational travel rather than stopping and getting vaccines. Get the shot. The other public health measures that we have advised, masking has come back as mandatory currently because of the numbers, but also hand washing. We've seen several healthcare facilities have to restrict visiting because of basically some slippage in hand washing. And these things work. We, in view of the concerns of the area and the interest of the rest of the population, will issue over the weekend at 2 o'clock a written update like we have done on Monday, Wednesdays and Fridays, just through this weekend to keep public informed. Again, I would encourage you, if you have symptoms, to go and get tested. 811 cannot provide public health advice. They cannot provide you with an appointment. If you have no internet access and ring 811, they simply use the software anybody who has internet access would use, and then public health do the rest. Similarly, once your testing is done, a positive result will be communicated to you directly by public health, along with instructions to suit your particular circumstances, and in particular your vaccination status. In terms of negative results, those are accessed through the portal, either with your MCP number or with a PIN if you do not have that number for various reasons. So I'm not going to take up any more time except to emphasize again that the shot, the vaccine, is each of us our best protection, and it protects all of us and will allow us to resume and maintain a level of life in this province that is as near normal as possible until COVID finally fades, and that is not going to be tomorrow. Leslie, I'll turn it over to you to moderate the media. Thank you.
Thank you, Minister. We have 2 media in person and 3 joining by phone. The first round of the question and answer session will give each reporter the opportunity to ask 1 question and 1 follow-up. Following this, there will be a final round where each reporter will have the opportunity to ask 1 final question. Our first questions are from Peter Cowan with CBC. Please go ahead and make your way to the mic.
We've heard here that these outbreaks are happening in areas where the vaccination rate is lower. Can you give us the latest numbers in terms of what is the percentage of the population in this area that is fully vaccinated? And of these cases, what percentage are people who are fully vaccinated versus unvaccinated?
I can tell you that in the Twillingate area, the Twillingate itself, the 2-dose coverage is good. It's 84.8. In surrounding areas, it's a bit lower. So if we look at the whole Notre Dame Bay, it's 70.6%.
And the second part about cases?
So ask me that again, Peter. Sorry, your question was?
The cases that we've seen, what percentage are vaccinated versus unvaccinated?
So if we look at the cases, some of them now are, if we look in the New World Island area, there's 24 cases. 15 of those are presumptive, so I don't have the data yet on those being their vaccination status. And of course, if we have some children, they would be unvaccinated. And so there's the case numbers are very low at 24, so we have less than 10 people that were unvaccinated. Around in that number.
And you mentioned that travel in and out of areas should be that are affected by this alert level 3 should be restricted. There's a large running event that's planned for Twillingate for this weekend. Should that event go ahead?
So that event has been cancelled.
Okay, thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead and make your way to the mic.
Hi. thank you, Dr. Xavier. Just to follow up on Peter's question, I didn't quite hear it, so I may have missed it, but just to clarify, how many of our active cases are breakthrough cases?
So breakthrough in the areas that we have, say in Bay Verte, we have 21 of our cases are breakthrough. And then the numbers are too small for me to tell you much realistically about Twillingate because we've just started. We have, yeah, so I can certainly give you that next week, but we don't have anything because many of them are presumptive. Getting a presumptive case is great because we can get ahead of it, but we don't have all the information yet till they're confirmed.
When you're seeing these cases now rising, we're over 100 active cases now, how concerned are you for a healthcare system that we've been hearing from providers for months that they're in a crisis mode, and that's before a fourth wave hit?
Yeah, so, this is always a concern and always something we look at. We did have a presentation from Dr. Raman yesterday, and so looking at the numbers we are, and as you know, he's quite good at what he does. He has told us that at the moment, we're certainly not in an area where we're being overwhelmed. Our healthcare system would be overwhelmed. Even our total cases, as you know, now we're up to, what did I read you? 1,654, which for some provinces is what they see in a day.
We will now go to the phones. Our next questions are from Peter Jackson with the Telegram. Please go ahead.
Hi. You said you talked to Dr. Rahman yesterday. Can you give a better idea of what he told you about the situation here?
Sorry, I heard the first part, but not the second part of your question, Peter.
Can you give a better idea of what Dr. Rahman told you yesterday?
So Dr. Rahman is actually going to give a presentation on Wednesday, and will update us on the information that he put together. And I think one of the things that struck me, and that's why I also included in my briefing notes, one of Dr. Rahman's points was that Delta's a different beast. And that compared to if we look at what kind of vaccination rates we would have to have if we still had our old the original wild type variant, and then we compare it to what the kinds of vaccination rates we would have had to have if this had been similar to our February outbreak. Once we kick it up to Delta, where we require even higher vaccination rates to form that barrier or shield, if you like. Just because Delta is more transmissible, and so that's one of the things I think that Dr. Raman pointed out, which was it has been an eye opener across this country.
On Wednesday, when you talked about the cases at McDonald Drive Elementary, we've heard from parents who say that they end up speculating and the rumors start flying because they're not kept informed. They're told to sit back and wait for a call. Is there any way around this privacy issue where parents can be a little more informed about what's going on in a given school?
Yeah, and that's a really good question, Peter, and it's always a balance, and I think that I think the school's done a pretty good job in informing people, when there's, and especially the people that are involved. And that's kind of the way we tend to do it. And I know it's difficult with COVID because people then panic and sometimes they assume the very worst. But if the very worst is happening, I'll be here in front of you, there will be a media alert, like people will be notified, and public health does make that connection, through the school or via phone of people that will be contacts.
Okay, thank you.
Our next questions are from Brian Callahan with VOCM. Please go ahead.
Back to the issue of vaccinated versus unvaccinated. I guess we've been told that it doesn't matter if you are or not. I mean, you could still contract the virus and still spread it. So could you speak to the severity of illness? Like, how sick are people getting?
So that's and it's hard, and I know people who are sort of question vaccination bring up the very point you do. Well, I could get COVID if I had the vaccine, But what we do know, and what's borne out across this country, is that those who are vaccinated fare much better. They can, contract the virus and have mild symptoms, but versus those who those who are unvaccinated, are 12 times more likely to get COVID, 34 times more likely to get hospitalized, and 8 times more likely to die. So the vaccination, and as I said on Wednesday, it ain't perfect, but it's pretty damn good.
So, well, with that then, I mean, the numbers and the stats, as you said, the percentages are higher without that the stats that we have. But say, for an example, like the retirement home in Bay Verte, could you tell me, I mean, that was a very vulnerable population there. I'm sure there were a lot of nervous people, given aged and people with pre-existing conditions. So can you speak to specifically whether or not you're seeing more severe illness, given that this is what we've been told with Delta, that it spreads faster, and if you're unvaccinated, you could get sicker. But are we actually seeing that on the ground here?
So of course, the thing is, we have small numbers yet, right? So we have 17 in that retirement home. So, and I really can't, Peter, so I can give you generalities, but when you're talking about 17 people, if I start saying how many are in hospitalized, or people in the community can identify people, and so it becomes a difficult issue. But what I can tell you is that, I have told you that there's 2 people in hospital due to COVID severity, and I haven't said what region they're from, but so with the number of cases we have now, we have 2 people that are in hospital.
Thank you.
Our next questions are from Sarah Smelly with the Canadian Press. Please go ahead.
Hi there. How many schools across the province have confirmed cases of COVID-19 right now?
So right now, there's 5 schools in Bay Verte. So there's one school that has, one school there that has 1 case that is now under investigation, and there's no signs at this point that there's any transmission within the school in that area. And then in our sort of Twillingate, New World Island area, which is the reason we closed that school, that was a different situation in which we saw that there were multiple cases in the school, and sometimes it can be difficult to say, did they get this at a birthday party or bowling, or was there transmission within the school? But when we suspect that there could be transmission in the school, then we take that extra step to close the school.
Okay, so to be clear, it's just the 5 schools in Bay Verte right now?
No, there's not. There's 5 schools in total in Bay Verte. There's 1 school that has a case that's connected, yeah. No, so sorry.
Okay, sorry, my phone is not great. Okay, and then I wanted to ask, given that we're having some, these schools affected, we're seeing PEI having kind of reversed course with respect to kids under 12. We have a lot of exposures at schools in New Brunswick. Have we misjudged our approach to kids under 12 with this Delta variant and this 4th wave?
I think, it's so important, and I think this is something that's been borne out in the last year and a half, that we keep kids as much as possible in school. And so this is, what we do. We look at each situation, we make that assessment. Our children are not vaccinated. We tend to know they do have milder illness, but still we want to obviously protect them from COVID-19. So for instance, just to give you an idea of what happens, myself and Dr. Dutt, had a discussion this afternoon about the Twillingate area. We'll always look at several factors. Does it look like there's transmission within the school? Because sometimes you might have somebody, for example, a kid that's infected at home. I mean, we know that's where most children are infected, is at within the family, and they might be in school, so it's got nothing to do with the school, if you like. So in that situation, we wouldn't shut down a school and deprive all the other children of what they need. We'd isolate that case. But if we, when Dr. Dudd and I talked this afternoon, we looked at what was happening within that specific school. We looked at the particulars of the case, which obviously I don't share. And then we looked at the vaccination rate in the community. And the decision was made that at that point that it was time to shut that school.
Thank you.
I will now go back to each reporter to see if you have one final question. Peter Cowan with CBC, do you have a final question?
I do. The PC critic for education has criticized the lack of information that government has been releasing, both about schools but also about cases in general. For example, there were no numbers released yesterday, even though there are several outbreaks and community transmission. I know you've said that there are going to be numbers released over the weekend. Why isn't the province able to give daily numbers throughout the weekday and is sticking with Monday, Wednesday, and Friday?
Peter, I'll take that one. On the specifics of education, the school district and the Department of Education are doing a media availability. My understanding is at 3 o'clock this afternoon to discuss the current situation. I think the question about numbers during for schools should be properly addressed by them. We have a situation now where COVID is endemic in the province. It's here. It will be here for some considerable time. At the level of case numbers that we had, we opted for Monday, Wednesday, and Friday. And we have said, and I have said just a few moments ago, that we will continue over the weekend to use media notices, such as we do on those days, to deal with numbers and provide information to the public over the weekend. This is going to be reviewed on an as-needed basis. If there is an issue, then we can supply numbers. If there isn't, then we'll do it on a more routine basis.
Kellyanne Roberts with NTV, do you have a final question?
Yes, thank you, Leslie. Dr. Sevier, I'm going to follow up on Sarah Smelly's question there. Wondering if it's possible to know how many schools in the province currently have a case of COVID-19.
So if I was, it would be 2. I mean, are you talking about some of them, like in McDonald Drive, which people...
McDonald Drive, I think we've heard of one in Glenwood.
So that's 3, yeah.
The school in Glenwood has said that it has a case? It posted a notice.
I would suggest that you direct those questions to Minister Osborne. He can give you a far better picture of the situation in the schools currently.
Okay, and just wondering if for future, if those can be noted on the releases that the media receive, not saying which schools, but that there are cases within schools. Just throwing it out there.
We'll certainly take that under consideration, Kellyanne.
Thank you.
Peter Jackson with The Telegram, do you have a final question?
Yes, hello. Have you and Dr. Dutt with Central Health come up with any sort of an explanation as to why the vaccine rate is so low in that area?
I think I heard Dr. Dutt's CBC interview with that, and I think yesterday and this morning, and I think I think one of the reasons is we feel fairly secure in Newfoundland and fairly safe, and especially in our smaller areas where we just don't think COVID's going to get there, and I think that's one of the reasons. And I know that we're also sort of reaching out to communities now and trying to understand that a bit better. To support people in making that choice.
Thank you.
Brian Callahan with VOCM, do you have a final question?
Yes, thanks. Could you tell me what, if any, link there is or been determined between the Bayvert cases, the case in New Orleans Island, and Twillingate?
So, no, I can't tell you that there's any connection between those cases at all, and that's still under investigation.
Thank you.
Sarah Smelly with the Canadian Press, do you have a final question?
Yes. I spoke with an epidemiologist who said that, for example, our decision to have kids in grade 4 and up wear masks, we should be having them all wear masks in schools, and we should even be considering moves like PEI's decision to start testing kids under 12 at the border, and that in general we should be focusing more on kids. I wonder what you have to say about that.
Yeah, I mean, I think we have put back the mask mandate, and really, for me, what we see in schools is a reflection of what's happening in our community. So it's to keep our levels in the community low, to increase our vaccinations, and that's really how we keep it out of the schools. So that's that's really our best bang for our buck.
Thank you, everyone. Minister, do you have any final comments for today?
I'd just like to emphasize once again that vaccination is our way back to nearer a normal kind of existence, the new normal, and that we have seen very clear demonstration of what happens in those communities where vaccination level is not sufficient to control the Delta variant. That level of collective vaccination is significantly higher than was needed for the original wild strain. And that's why, to some extent, our goalposts appear to have changed. It is possible to reach a reasonable level of protection in pretty well every community. But I can't do that. The communities have to. Get the shot. Thank you very much for your time.
Thank you, Minister. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.
This is Jan. Jan sometimes visits her neighbor Paul. Paul has COVID-19, but doesn't know it. Jan also takes the bus. So does Mo, who's a frontline worker. So if Paul infected Jan, Jan could infect Mo, who could infect a lot of people. But wait, they all have the COVID Alert app. So Paul tested positive and entered a code in his app, which anonymously alerted Jan, so Jan stayed home and Mo went to work safely. Phew, close call. Help break the chain of infection. A message from the Government of Canada.